Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you for joining us for another segment. In this segment, we're going to be speaking with Mr. Kyle Detwiler. He's joining us here as CEO of Clever Leaves Holdings to talk about how Clever Leaves is supporting the Colombian community from which they hail, what they're doing to help guarantee patient access amid a global supply chain crisis, and a bit about how they're becoming a global presence in the medical cannabis space. Welcome to Health Professional Radio, Kyle Detwiler. Thank you for taking the time this morning.
Yeah, thanks, Neil. Excited to be here on the radio. It's been a nice change from all these Zoom calls, and as they say, I have a great face for radio. So.
Well, you and I both. Well, I thank you for taking the time out this morning. If you would give our listeners a bit of insight into your professional background and talk about being CEO of Clever Leaves Holdings briefly.
Of course. So most of my career I spent in the private equity industry. I worked at KKR and the Blackstone Group and focused generally on two main industries. The first was healthcare, where a preponderance of that was spent in pharmaceuticals and medical devices, where a general theme is moving high-cost operations to low-cost regions like Southeast Asia, for example. And the other, industry work in the natural resource space. I spent a lot of time in Latin America around agriculture, so sugarcane, blueberries, asparagus. If you want your strawberries to grow fresh year-round and you want to leave as minimal, if not a negative, carbon footprint, moving these types of operations to equatorial regions is sort of fashion-forward agriculture. And it's really those two ideas that were synthesized to create Clever Leaves today. And the simple thesis behind Clever Leaves was that, cannabis production until recently has not been built in places that were economically or environmentally friendly. It was just put where it was first legal. Probably doesn't strike many people as natural to build, very significant cannabis facilities in countries like Canada where it snows, it can be dark for, many parts of the year. And Clever Leaves' vision was to transform and disrupt the cannabis industry and move that production to more logical places, such as Colombia or Portugal. And so today, Clever Leaves is probably the biggest producer of federally licensed cannabis outside of North America. That is our mission, to change the supply chain for medical cannabis and also lower the cost of the whole system so that we can pass those savings on to customers, whether those be other cannabis companies or directly with patients.
You mentioned Colombia briefly in talking about producing cannabis outside the United States. What is it specifically about Colombia? Is it simply the climate, the region, or were there other reasons that Clever Leaves is supporting that particular community?
Yeah, when we first started analyzing the cannabis industry in 2015, 2016, you had to run your analysis through a couple of different factors. Of course, one of the most important is where does botanical cannabis grow best? And we looked at places like Canada and the United States and Jamaica, Puerto Rico, some of the Caribbean islands. We heard rumors about things in Thailand. We sent teams over to China. Of course, we looked in Latin America, including Colombia. And you then have to overlay the fact that, we are talking about medical cannabis. And, cannabis is still a capital crime to possess in certain parts of the world, right? So it's not like you can just put these things anywhere. Colombia really, hit all of the factors square in the middle. It's a great flower-producing country. Most people aren't aware, but, 7 in 10 cut flower imports to the United States actually come from Colombia. So that supply chain, that horticultural know-how that already exists, and it's been adapted for, roses and chrysanthemums, and, we began to adapt it for cannabis. On top of that, the regulations were also very clear. Mm-hmm. It was a medical market only. Originally we could only produce extracts that, kind of lent itself to a very pharmaceutical approach. So there are other factors as well. The cost structure of Colombia is extremely attractive. It costs us about 90% less to produce medical cannabis on a per gram basis than it would in, say, countries like Canada. So combine all those things, and that's what led us to Colombia.
With all of the positives that you just mentioned, what about the supply chain, crisis that we currently find ourselves in? How is Clever Leaves navigating that particular situation?
Yeah, there's really two supply chain crises that Clever Leaves is facing today. One is the one that most people are familiar with, right? We have ships lined up at ports around the world. COVID is disrupting production chains. There's ripples through supply chains. If you can't get caps for a certain bottle, well, you're not going to get finished products moved on to the next part of the value chain. So that's not unique among Clever Leaves, but it's also very difficult in cannabis because moving controlled substances across international boundaries is not easy. Not every airline, for example, will load cannabis, whether you have import and export permits or not. That makes things very challenging, assuming the flights are consistent in the first place anyways, right? There's not as many flights going from Bogota direct to Sydney, for example. I think the other supply chain problem that Clever Leaves faces, which is unique, is we have a very logical business idea, and the thesis of Clever Leaves is to create an international trade of cannabis, but it takes a long time for that to develop. We face a lot of red tape. There are countries out there like Canada that have blocked all commercial imports of cannabis. That's become so egregious that the country of Colombia is now pursuing that case against Canada in the World Trade Organization. So that's another supply chain bottleneck that we are imposed, which is a little unique to the cannabis industry and to Clever Leaves.
Now, I understand that there have been decades and decades of missed opportunities into researching the medical benefits of cannabis. And I understand also that Clever Leaves has committed to donating $25 million worth of cannabis to research institutions in an effort to account for those missed opportunities. I understand that it's called Project Change Lives. Could you speak to that briefly and tell us what that's all about?
Absolutely. It's quite remarkable that even though we have FDA-approved drugs that are essentially entirely comprised of cannabinoids when it comes to the active pharmaceutical ingredient, that there's really not a good way for U.S. researchers to get access to this product. Historically, there's only been one federally licensed operation in the whole United States that is located at the University of Mississippi. And it's very difficult for pharmaceutical companies or academic institutions to do research on a Schedule I controlled substance. So the idea for Project Change Lives was, okay, well, we know that at this point, most of Americans have a anecdotal experience with cannabis, which is positive. Not everyone, but most. We have a couple of, illustrations of, proven and clinically backed data to suggest that cannabis can be helpful. So one way to bring cannabis away from anecdote and into, traditional pharmacology would be to help accelerate this research. And since one of the major bottlenecks of that is the fact that there is only one source of supply today, that source of supply does not produce products which are similar to cannabis products that are, purchased recreationally by patients in, say, California or Colorado, that largely being the THC concentration. So the University of Mississippi produces generally flower-only products, and the THC concentrations are maybe 7% to 8, 10%. Whereas, if you walked into a dispensary in California, you might see products with 20%, 25%, or even 30% THC. So if you're not doing research on the products that people are using, or you're not doing the research at all, we're never going to advance the field of science and enter Project Change Lives. Because Clever Leaves can produce this medicine at such a low cost, we wanted to ignite the research in this industry by simply giving it away. We wanted to take that bottleneck off of the table when it comes to researchers thinking about, hey, what am I going to spend my next academic year researching? Which grants can I pursue? Now, of course, free product or free, medical ingredient going into a trial is not the whole cost of a trial. Like there are other things that, Clever Leaves unfortunately can't pay for. But we've had a couple of universities, University of Missouri, UC Davis, which have picked up on this program. I hope that the significance of this will be appreciated over time. That's the thesis for the mission.
Well, give us a website, if you would, where we can learn more about Clever Leaves Holdings.
Sure. It's just cleverleaves.com. CLEVERLAVES.com.
Well, Kyle, I appreciate your time and your information this morning. Thank you so much for joining us here on Health Professional Radio.
Thanks, Neil.
Right. You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Kyle Detwiler, CEO of Clever Leaves Holdings. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download it, SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.